Hey everybody, it's your favorite doctor here, Dr. Tiffany Butler, and welcome to my channel. And in this video, I'm going to discuss cervical spine pain or neck pain. Alright, so let's review the anatomy first so you know what I'm talking about. Let me get my spine here. Alright, so here we go. So this spine is positioned like this, alright, as if this was my spine and I'm facing that way, okay? I'm facing that way. So the cervical spine has 7 vertebrae. It's the purple parts, alright? And in between each vertebra is the spinal disc, or vertebral disc, however you want to call it. And the vertebral disc is important because it helps provide cushion for the vertebrae so the bones won't be rubbing against each other. The disc also provides height for your cervical spine. So, you know, as we get older, we sort of start to shrink. And a lot of times it's because the degenerative changes, all right, of the vertebra, all right. Now you may also notice a little bit of shrinkage throughout the day. When you get in the car in the morning, you know, you're a certain height, your mirrors may be well adjusted, but when you go get in the car in the evening to go home, you may have to readjust it because during the day, the water that's inside of the vertebral disc goes out, gets pumped out, but as you sleep at night, the body reabsorbs the water, all right? It reabsorbs it in the disc, all right? Okay, let me keep going. All right, so that's it. Vertebral body, or the vertebra, the vertebral disc, or just the plain disc. These yellow things is the spinal nerves that comes off of the spinal cord, and the spinal cord is an extension of the brain. So this thing, that's what it is. Think of your spinal cord as just your brain just traveling throughout your entire body. It's made up of the same material, which is gray and white matter, and very important structure, all right? This is why it's protected by heart stuff. All right, so that's your anatomy of the spine. All right, now what causes neck pain or neck dysfunction? The first is pathology. So pathology would be degenerative changes in the structure of the neck, all right? So we're talking about the bones. So what's most commonly seen that I've seen in the office is degenerative disc disease, so meaning the disc is no longer nice and for lack of a better word, fluffy. It's starting to thin out, and as a result, that can cause pain. You have the bones actually changing itself, where that's what we call degenerative joint disease, so DJD, or osteoarthritis or spinal osteoarthritis. And a lot of times the arthritis is diagnosed based on plain film, so x-rays. We start to see the changes. All right. Now, the reason why degenerative changes happens is because of abnormal position. All right. Now, the way our bodies are made, I mean, they're perfectly and beautifully made. The way the spine is made is so that it can distribute weight properly and even throughout the body. So as we're walking, we always have gravity on us. As we're sitting and all these good things, gravity is always on us. So the energy of gravity comes down, the weight comes down, top of our head, goes through our spine, goes out through the shoulders, but it also continues to travel down the spine, goes out through the hips, and down and out through the legs and through the feet. But we also have energy or forces coming from the ground, right? When we're walking, we're running, so that energy from the force, it has to go somewhere. So the same, it does the opposite thing. It goes up through the feet, through the knees, hips, goes up the lower back or the lumbar spine, up, travels through the spine, goes out the shoulders and out through the top of the head. All right. Now, I said before that the degenerative changes happens when the body is in an abnormal postural position. So a lot of times the changes happen gradually over a period of time. So we usually don't start to see it until people are like, I've seen it as young as 28, all right? And then you start to see it as we get older, which means at some point in time, you're going to have some type of degenerative changes in your body. If you live long enough, you will, all right? So that's one of the common causes of neck pain is just having arthritis, degenerative joint disease, or degenerative disc disease. The second thing is muscle spasms or muscle tightness, and this happens usually as a result of an injury to the neck, all right? This is commonly seen, of course, in car accidents. This can happen if you are playing sports, like if your sport requires you to move your head a lot or frequently. This can happen if you are sitting at a computer or sitting at a desk, or if you're a banker or something like that. that can cause neck pain. If you're a driver, you sit in a car, you're driving all day, every day, you're constantly moving your head and neck, that could cause neck pain because of muscle spasm, muscle tightness, all right? And as a result, your muscles get fatigued. So when they get fatigued, they start to tighten or become spastic, all right? And there's a way that your body tries to stabilize the area to pretty much prevent you from damaging it any further. So we would call those things micro trauma because it happens over a period of time. Micro trauma. And a macro trauma or big trauma would be like a car accident. You're sitting at the stoplight and boom, you get hit in the back or you get hit in the side and your head gets whipped around. All right. So pathology, such as degeneration, causes neck pain. Muscle tightness, muscle spasm can cause neck pain. And that could be a result of a micro trauma, such as driving. If you're a driver, if you have any type of occupation where you're sitting for prolonged periods of time, using computers, stuff like that, that can cause neck pain. As well as sleeping abnormally, right? If you sleep with a whole bunch of pillows or no pillows at all, that can cause neck pain. And if you sleep on your stomach, like sleeping on your stomach is like the worst position to sleep in. You know, once you get past like 12, stop sleeping on your stomach, all right? Because your neck is going to hurt. Make sure you have pillows, not a whole bunch of pillows, but get the right pillow that supports your neck and your spine while you're sleeping. You want your spine to be in the neutral position, meaning straight when you're sleeping. So the best position to sleep in is on your back or on your side, all right? And that's the only ones I can think of right now that can cause the neck pain besides things serious such as meningitis, all right? And meningitis usually is a result, it will not only cause neck pain, but you will also have a fever too. All right, so anytime your children have neck pain and they're young, you know, you want to, and they have a fever, it is a medical emergency, you want to take them to the hospital. Even yourself, if you're having neck pain and you have a fever, go to the hospital because you could have meningitis. All right. Now, how can a chiropractor such as myself, Dr. Tiffany Butler, help you if you have neck pain? All right, so the goal of chiropractic care, if you've seen previous videos, is to place the body in the best position so that it can heal naturally. As a chiropractor, we do something called spinal adjustments. All right, the goal of the spinal adjustment is to mobilize the joints so that you can move. When we mobilize the joints, we break up scar tissue. The scar tissue is laid down when you have an injury. So anytime you injure yourself, you tear something. You either tear the ligaments, you're tearing the tendons, or you're tearing the muscles itself. And the body puts down scar tissue, which is connective tissue, to sort of like heal the area. Now, the normal muscle fibers are sort of like this, all right? They're lined, so when you turn your head and bend it and all that good stuff, it's nice and smooth, all right? I want you to see, if you can see, you see how the muscle fibers are, right? See how they're going in the same line? Now, what the body does, the body just throws it down. It just like dumps it, so it's sort of like this. So as a result, your head is not going to turn as far because you have what we call adhesive scar tissue. So there's a little bit of sticky or gluey like gum, all right? Now, by mobilizing the joints through spinal adjustments, you break up the scar tissue. As a result, you'll start to move better. And as you move better, the inflammation and swelling that's in the area because of lack of motion starts to get pumped out of the area. And now the nerves, which is the signal that lets you know that you're in pain, is less irritated. Does that make sense? All right, so that's the science behind chiropractic care. This is why it helps and this is why it works. All right. Now, your chiropractor will not only give you adjustments. Your chiropractor, if they're a great chiropractor, they would give you rehab exercises because anytime you injure yourself, the tissues, again, is never the same. They're a little bit weaker. Even though you break up the scar tissue and things like that, it's going to heal, but it's not as strong as the normal tissue or uninjured tissue. So the exercises will help strengthen the muscles so that you can reduce your risk of having an injury again. And you want to create what we call muscle balance, all right? So you want to make sure that your muscles are not only strong, but that they're also flexible, all right? And your joints are also flexible. So a good chiropractor will not only adjust you, but they will also give you exercises to help rehab your tissues, all right? Now, if your chiropractor doesn't give you any exercises, guess what you got available to you? You got this book here, Say Goodbye to Back Pain, Exercise, Nutrition, and More, written by yours truly. And in chapter, I believe, chapter 11, chapter 10 and on, I give some really good exercises on what you could do, right, at home to just start moving your neck around. All right, so if your chiro doesn't give you any exercising like that, you want to pick up a copy of this book, Say Goodbye to Back Pain, Exercise, Nutrition, and More. It's on Amazon for purchase. All right, so that's how I can help you as a chiropractor. Now, what can you do for yourself? You can rest. You know, after an injury, rest for the first 3 days. You can ice it. That's all you want to do is ice. Ice for 15 minutes on, 15 minutes off, as often as possible. That will help control the inflammation and swelling. After that, you need to start incorporating some type of exercise. You know, either moving your head, just bending your head to the side, or things like that. You want to do that. You don't want to just continue to turn your whole body, right? We have a tendency, if we're in pain, if it hurts to move, we don't move. And that can actually make it worse. If you continue to experience neck pain for more than 5 days, you know, I say after 3 days, if it hasn't gotten better and you've done everything, go get help. But 5 days, go see somebody. Preferably go see a chiropractor, right? Because this is what we see all day, every day. If you don't have a chiropractor in your area, then go see a physical therapist. You know, they can help give you those rehab exercises and teach you what you can do to help your neck. All right, so when you're at home, first 3 days you want to ice. After that, you can do ice and or heat, and get under somebody's professional care if you want maximum benefits. You know, don't delay. Get help right away, all right? Now, some of the consequences of not getting care and waiting until the pain becomes chronic. And chronic is 3 months or greater. And unfortunately, people just continue to eat medicine. You know, even if the medicine is just giving you temporary relief, the pain comes back. And you have to ask yourself, is the medicine really helping? Yeah, the medicine may be controlling the pain. It may be controlling the inflammation, but it does not correct the problem. The problem is you have injured tissues, you have scar tissue, and you need to break it up, which means you need to do some type of rehab, all right? So go do yourself a favor and get some rehab, all right? Don't just continue to eat medicine. Now, the consequences of not seeking care is that your condition will become chronic. So an injury that you may have gotten in the beginning of the year, you know, it could have gotten better if you just got help sooner or later. So your condition could become worse. You can lose range of motion or inflexibility. It can also lead to a disability, all right? And it can also cause degeneration down the road, as well as it can just have a negative impact on your overall life. You know, just imagine if you're driving and your neck hurt, you can't turn your head, right? You have to turn your whole body. You know, who wants to do that? Come on now. You know, and the pain may interrupt you from sleeping at night, and it's important for you to get rest. All right, so do yourself a favor. If anytime you experience an injury to your neck, if you have neck pain and you've done all that you can, it has not gotten better in 5 days, I say see someone sooner than that. Go seek the help of a chiropractor. Google chiropractic area. If you're in the DMV area, come on, look me up, Dr. Butler. You know, Google me, you'll find me. All right, Dr. Tiffany Butler. All right, so hopefully you liked this video. Hopefully you learned something. If you like it, hit the like button. If you want to share, go ahead, share. Leave a comment down below. If you have any health topics you want me to address, I'm open to talking pretty much about anything. Then put that in the comments as well. Make sure that you subscribe and take care of yourself. All right, and remember, healthy mind and healthy body creates a healthy life. Stay healthy.